A pediatric SOAP note is a structured documentation method used by healthcare providers to record a child's medical condition, treatment, and progress. Using eAuditor for Pediatric SOAP Note Assessment helps medical teams digitize assessments, identify documentation gaps, track errors, and ensure standardization. This process verifies that patient documentation is accurate, complete, and compliant with healthcare standards, ultimately improving pediatric care and communication among providers. The preparation stage involves defining the assessment scope, selecting the eAuditor checklist, and gathering relevant data. Evaluating SOAP notes for clarity, completeness, and accuracy while ensuring compliance with pediatric documentation guidelines and legal requirements is crucial. Reviewing each SOAP component for proper documentation, assessing legibility, and verifying adherence to facility protocols and pediatric-specific documentation needs are essential steps. Accessing pediatric medical records, previous SOAP notes, and facility documentation policies ensures comprehensive assessment. The subjective section captures the patient's history, symptoms, and complaints as reported by parents or older children. This critical information forms the foundation of the clinical assessment. During the eAuditor assessment, reviewers verify that notes clearly document chief complaints, symptom onset, feeding and sleeping patterns, developmental milestones, and behavioral concerns. The assessment also checks for missing details that could potentially affect diagnosis and treatment decisions, ensuring the subjective information is comprehensive enough to support clinical reasoning. The objective section assesses vital signs, growth measurements, physical examination findings, and laboratory results. Confirming documentation of temperature, heart rate, respiration rate, blood pressure, and pain scores is crucial. Ensuring weight, height, length, head circumference, and BMI are recorded and plotted on appropriate growth charts is necessary. Observations of skin color, hydration status, respiratory sounds, and other physical findings are detailed. Verifying that all clinical measurements and findings are accurately documented provides concrete data to support the subsequent assessment and plan, helping identify any emerging information that could impact clinical decision-making. The assessment section of a pediatric SOAP note represents the healthcare provider's clinical reasoning and diagnosis based on the subjective and objective information. During the eAuditor review, evaluators check whether the assessment demonstrates sound clinical judgment that logically connects reported symptoms with observed findings. Reviewers verify that age-appropriate conditions are considered, including developmental milestones, common pediatric illnesses, and vaccination status. The assessment should clearly communicate the provider's diagnostic reasoning to other healthcare team members. The plan section outlines the treatment strategy and next steps in the child's care. eAuditor assessment ensures this component provides clear directions for all parties involved in the child's care, from healthcare providers to parents and caregivers. Verifying prescribed medications, dosage calculations, and administration instructions are age-appropriate and clearly documented is essential. Ensuring hydration, nutrition advice and home care guidelines are detailed and understandable is crucial. Checking that necessary follow-up appointments and monitoring recommendations are specified, and referrals to pediatric specialists are documented when needed. After completing the SOAP note review, eAuditor generates comprehensive assessment reports that summarize findings and identify documentation errors. These reports provide actionable insights for healthcare teams, highlighting areas where documentation can be improved to better support pediatric patient care. The automated reporting system allows for efficient tracking of compliance trends over time, helping healthcare facilities identify systemic issues that may require additional training or process improvements. The final stage in the Pediatric SOAP Note Assessment process focuses on implementing improvements and establishing a cycle of continuous quality enhancement. By using eAuditor to track documentation trends over time, healthcare facilities can create a culture of excellence in pediatric care. Notifying relevant staff about inconsistencies and implementing mandatory refresher training on SOAP note accuracy for pediatric documentation is essential. Conducting regular pediatric SOAP note audits to maintain compliance and update documentation protocols based on recurring issues is crucial. Enhancing staff training on effective pediatric documentation and reinforcing legal and ethical requirements in pediatric records, along with monitoring long-term assessments to track improvements and revise templates to meet evolving pediatric care needs, are key components.